السلام عليكم ورحمة الله وبركاته. الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين سيدنا ونبينا ومولانا محمد وعلى آله وصحبه أجمعين. Welcome to Health Matters, a comprehensive chat with the Islamic Medical Association on ITV. I'm Dr. Shoayb Wadee, and once more I've got Dr. Nadia Jajbhay here with me today, and we're once more going to be discussing breast health and breast cancer. And I'd like to welcome you to call in to us early, because the last time we had a discussion, we had quite a lot of calls which came in after the show, and inshallah we can get through a discussion on some of the topics which are troubling you about this topic. As usual, before the show, we get into the medical aspect of the show, I'd just like to discuss some of the Islamic elements which are involved in our practice. We know that we are currently in the month of Muharram. We're experiencing a new Islamic year. It's a time, in Western civilization, when the new year comes around, they make resolutions. And what's a resolution? A resolution is when you resolve to do something. And when you say resolve, it means two things. It means that really you want to solve a problem, that there's a problem that you're going to resolve. And secondly, the meaning resolve in English means that you show resolve. You're going to have a determination. You're going to have a distinct desire to make sure that that problem is overcome. So Islamically, we don't necessarily wait for a new year. One of the critical aspects of Islam, in fact, it's something which Allah subhanahu wa ta'ala mentions in the Quran repeatedly, is the aspect of reflection. And Allah subhanahu wa ta'ala says many times that Allah loves those who reflect, or surely there is much for us to see if we would just reflect. So there are many ayahs of the Quran where Allah asks us to reflect or to think or to ponder. And the Prophet ﷺ has also said that reflection is one of the most beloved things to Allah subhanahu wa ta'ala. In Islam we call this concept tafakkur. And reflection, how do you reconcile reflection and a resolution? A resolution is, as I said, you need to solve a problem. But how do you discover what the problem is? How do you discover what needs to be done in your life? What needs to be done for the ummah? What needs to be done, even if it's a medical problem? The only way is to reflect on what the problems may be, how your life is going, how your day is going. As Muslims, we are supposed to be in constant reflection. It's difficult. It's only the most pious people who reflect on every single action, everything they do, every moment. But for the rest of us, sometimes, we have to be reminded to reflect. There are many opportunities, maybe after every salah, maybe when we're resting, maybe before we go and sleep, maybe every day, every Friday. But I think it is important for every one of us to make a constant effort to reflect, to self-reflect, to self-criticize, to analyze what problems we may be having, what problems we may be able to solve, both for ourselves and others, whether we're involved in actions which are sinful, which are harmful to ourselves in this world and in the year after, and whether we are involved in things which are harmful for our community. So that's my message for today. And it is linked to our topic for today, because similarly, as we examine ourselves spiritually, it's important to examine ourselves physically, so that we may pick up problems early. Assalamu alaikum wa rahmatullahi wa barakatuh, Nadia, and welcome once more.
Wa alaikum salam wa rahmatullahi wa barakatuh, Shoayb. Jazakallah khair to have me again.
As I mentioned, we're going to be discussing again breast cancer and breast screening. Will you give the viewers an idea of why you think it's so important that we should go through this again, and also try and encourage them to call in with their problems?
Bismillahir Rahmanir Rahim. I'm thinking about what I could tell the viewers as far as breast cancer that they don't know about, that they haven't heard. I think it's apt that we're talking in November, because everybody knows October is Breast Cancer Awareness Month. My feeling is every day is Women's Day, and every month is Breast Cancer Awareness Month. It's such an important topic, and I hope that by the end of this discussion, the viewers have a feeling of importance, that breast health is important, breast cancer does exist, and they actively or proactively go through and go for breast examinations. And the men out there actually sit and think, hey, my wife, my daughter, my mom needs to have a breast examination, and those things that are keeping us back, our fears or maybe the myths surrounding breast cancer, it's not going to happen to me, it's somebody else's disease, old white woman's disease, etc., 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 are dispelled here, and we proactively take charge of our health, and breast is important, inshallah.
I think one of the things that we wanted to do on today's show is really reflect on the personal aspects and how breast cancer affects your humanity and how it affects people. And I think that's one of the reasons, Lawad, I'd like to encourage viewers to call in. As you know, our number is 011 086 7700 or 7701 or 2 or 3, and the numbers are appearing on the screen. I'd like to encourage women who have been touched by breast cancer, who may have been diagnosed with breast cancer, who have experiences around their family members with breast cancer, to call in. Also those who are concerned about whether they may be at risk for breast cancer, whether they should be screening, whether they should be doing self-examination and so forth and so on. And we can, inshallah, try and engage with the topic in that way today.
Inshallah. Shoayb, I find it, and Jazakallah khair, to mention about reflection. You know, I found myself reflecting as a Muslim, as a woman, and as a medical practitioner, as a radiologist, in fact. Having qualified, having worked in the public sector, having worked in the private sector, and looking at my patients and seeing the difference in survivals, particularly with breast cancer. I wasn't specifically in women's health.
Sure.
And I noticed women dying of breast cancer, coming in with advanced disease. And then the other paradigm, women coming in having survived breast cancer. And I thought, but why? Is there something that can be done? What's the difference? What is accounted for women surviving, and what is accounted for women who've come in with end-stage disease? What are the factors surrounding it? And alhamdulillah, you know, the path took me along, women coming to me and saying, where can we find you? We're fearful of being examined by a man. Mammograms are painful. Breast cancer can't happen to me. I'm young. I don't have a family history. All these, which are now, in fact, myths. Alhamdulillah, and I found myself really duty-bound as a Muslim woman, that something our community needed. I think women in general, every woman needed a woman that was examining them, and really a personal type of interaction about breast, because you come in with a fear. You might not go in with a lump or a problem, but you've been sent for screening, meaning I'm otherwise well, I need to be checking if I have breast cancer. I'm in the risk category from 35 onwards. And women under 35 can be screened via ultrasound, and if any woman who has a problem then needs to be coming in, whether it be a lump, a pain, a discharge, etc. And I found women come in, and if their problem isn't addressed, and if they haven't discussed the issue, there's a lot of psychological impact.
Sure.
And the psychological trauma can affect the physical being, and I think both are intertwined.
Sure. No, I think it's important to note that there's a couple of things. The one is that I think the majority of women who are going to come in for breast screening are not going to have breast cancer.
Yes.
And most screening initiatives, including that for breast cancer and many other types of disease, the majority of people are not going to have the condition. You're throwing a wide net to try and pick out those people and diagnose them early, which does mean obviously that a lot of people are going to be tested, but there's no other current way to pick up some of these cases early enough, except testing a whole lot of people, because we don't have the refinements in terms of the understanding of which particular individual is going to get breast cancer, even given the risk factors. But there are some things which are more likely to lead to breast cancer. And you can just tell us what the risk factors are, Nadia?
All right, Shoayb. So being a woman, it's already a risk factor. You're 100 times more susceptible than a man. Okay, right. Age has a lot to do with it. So at age 30 compared to age 50, you've got a 10-fold increase of risk by the time you hit 50 as compared to 30.
So the older you are, the higher the risk is.
Yes.
Okay.
And then there comes the other factors. There's some that are lifestyle related that we can modify, and there are other factors that we can do nothing about. And then there's the big unknown. 60% of women who actually present with breast cancer is the unknown. Let's talk about the things we can do about, because it's about prevention, it's about knowing your risk, and it's about our GPs, our gynaes identifying the risk, so that women who are susceptible or who are in a higher risk category are sent earlier for screening. Okay? So being overweight, these are the lifestyle things. If you're overweight, look, breast cancer really mainly is stimulated by a hormonal factor. So estrogenic stimulation. So all the risk factors that I'm mentioning, most of them are related to hormonal predisposition.
Estrogen.
So if you're overweight, you have a higher level of estrogen in the system.
Well, some of your fat gets converted by enzymes in the adipose tissue into estrogen. So that's why women who are very overweight will have abnormalities in their hormonal cycles, may have abnormalities in their menses and so forth and so on.
Exactly. Alcohol use, so women who are drinking alcohol daily are increasing their risk by 30% than somebody who is not. And it's also related to estrogen. Very dense breasts. So dense breasts are it's just a word we use.
There's not much you can do about that.
No, you're actually born with it, but it also reflects about the amount of estrogen in the system. Exercise, sorry, I was talking about the lifestyle risk. So we should be exercising. That drops your estrogen levels, also keeps you in a healthier lifestyle.
Sure, I mean, obviously moderation, if you're going to exercise to a level of anorexia and severe estrogen deficiency.
So the guideline is about 45 minutes for about 5 times a week, at least 3 times a week.
And we've harped on about this for many months now on this program, so I'm sure people who've been regular viewers are aware of the benefits of exercise. And obviously everything in moderation. I wouldn't exercise, 10 hours a day or something like that. You're obviously going to cause damage to yourself, but you can't exercise breast cancer away or anything, but if you exercise in moderation, will protect you.
The big one is childbearing. So if you haven't had any children, or you've had children after 30 or later in life, then there is a higher risk for breast cancer.
So that's because you have a longer period of unopposed estrogen. Because when you're pregnant,
many more menstrual cycles.
Yeah, when you're pregnant, you have more progesterone in your system and so forth and so on. So there's less exposure to estrogen during pregnancy.
Exactly. Also breastfeeding. So breastfeeding is going to reduce the amount of menses you have. Also related to, that directly relates to very early menarche, or the first time you have a period. So at age 12 is the average, but if you have had, and our young girls are getting a much earlier period at age 8, 9 and 10. So that's also a risk factor, something we can't do anything about. And then late menopause, having menopause after age 55. But the big one we haven't mentioned here, which relates to lifestyle, is with a change in paradigm of our lifestyles compared to our great grannies. These women were thinner, more active. They had more children. Yes, we had more children earlier in life. They breastfed, but they also used much less hormone than we did. Now we're delaying pregnancy, so we're using oral contraceptive use, but how it's related is 10 years of continuous use. More than that is now a risk factor for breast cancer. And then these are the same women who are now struggling to get pregnant now after 30 and are using fertility. So repeated fertility treatment is also a risk. And now the big one we know about hormone replacement therapy, very controversial. Combined hormone replacement therapy is a definite risk for breast cancer and increase your risk. So if you open up any pamphlet related to your HRT, even to the oral contraceptive, it'll say, please, if you are a breast cancer risk,
you can't use
it's because of the hormonal stimulation of most cancers. 60% of breast cancers are estrogen and progesterone positive. So they can grow if there's excessive estrogen in the system.
Okay.
Right. Smoking, not directly related to breast cancer itself, but to all cancers.
Sure.
And actually, women with breast cancer do worse on treatment and prognosis, survival, if they are smokers.
Smoking is a big problem, and we've discussed it before on the show as well. And I think it's important that people understand that the risks are multiple when it comes to not just cancer, but also how you tolerate the treatment of cancer, whether it's surgery, whether it's chemotherapy, radiotherapy, even non-medical therapies are tolerated less well in patients who are smokers.
The other thing is, well, we're talking about breast cancer today, but as women, I'm duty bound to tell women that, your cervical cancer risk is doubled if you smoke. I hope that puts you off smoking.
No, I think smoking is a big issue, and it's become much commoner in groups where it wasn't very common before, like women and so forth. So I think that's really something which people need to be cognizant about. Yeah. Okay. I mean, in terms of the non-modifiable risk factors, I think we'll get to that. Let's go to an ad break, and then inshallah we'll come back for some calls, inshallah, and also we'll discuss some of the non-modifiable risk factors.
Genetics only 10% of breast cancers. 5 to 10%.
Zain Beaker Studios and Islamic Relief South Africa proudly presents an unforgettable theatre production filled with song and spirituality. An Orphan's Tale. A heartwarming, emotional play about 4 orphan children and their incredible journey to find God. Presented by the learners of the Leadership College, a Two Oceans School initiative in Cape Town. This spectacular play will inspire you with tears and laughter. Join us at the Islamia School Auditorium, 29th October to 2nd November 2014. Seats are limited, so book now. An Orphan's Tale.
This film can be set in Cape Town or in Paris, and in the leading role could be an actress or a family man or a businessman. Beside him sits an artist, musician, his colleague, another colleague, or his boss. And the car they're traveling in is a C-Class or a C-Class or a C-Class. The best knows.
Brought to you by Century Motors, Mercedes-Benz Dealer of the Year 2014.
Spice Mecca's newly packaged spices, categorized by spicy orange, exotic red, natural green, and magical purple. Use our blends and seasonings, masalas, herbs, or pure ground and whole spices to create yet another unforgettable taste experience. Choose your color, choose your number. We have your taste. So come on, do it the Spice Mecca way, the cook easy way.
Spectre Door Supplies are manufacturers of standard and customized interior and exterior wooden doors and door frames. Spectre Doors Supplies offers you a wide range of quality doors for your home and business, from simple to complex design, interior and exterior doors manufactured to suit your specifications. Our experienced and efficient team is dedicated to design and create ideal products to suit your needs. For trade inquiries, visit our website. Spectre Doors, good service and quality products at the right prices assured.
Adega, an upmarket Portuguese restaurant that offers a unique and memorable dining experience. The restaurant offers a warm ambience and was voted Best of Johannesburg, Best Portuguese Restaurant for 7 years running. We aim to provide the best quality food and service. Make your booking today and enjoy fine dining at its best. Adega Restaurants, always open, always good. Fruit 10 aloe vera juice. No preservatives, no additives. Good till the last bits. Taste it, you'll love it. Another quality product from Marhaba Trading.
Medical Association. We are discussing breast health and breast cancer and issues around screening and diagnosis and treatment, and we're waiting anxiously for some of your calls, so please call in. But what we really want to discuss now, Nadia, is we were getting to some of the non-modifiable risk factors, and really there's not many, but the big one is probably genetics.
Yes, so genetics accounts for 5 to 10% of breast cancers. So if you have a first degree relative with a breast cancer, so this is a mom, a sister, then or a daughter, you have a doubled risk compared to somebody who is not affected genetically. And if you now have another relative, then you're tripling your risk. So it's incremental. Okay, so genetics is important. Remember,
so I mean that's quite a substantial quantifiable risk compared to most of the modifiable risk factors. It's difficult to quantify exactly how much each individual's risk is. And while genetics is only responsible for the minority of cancers, if you do have a family member who has had breast cancer, especially a first degree relative, your mum or your sister, it really puts you in the ballpark of having a stronger risk of for cancer. Doubles your risk, as you say. Yeah.
Yes. There's much more awareness about genetics because, you know, the likes of Angelina Jolie and so forth. Incidentally, male breast cancer is very much genetic. So if you've got a male relative who's been affected by breast cancer, then the women should be screened in the family. Breast cancer the breast cancer gene does not only code for breast cancer, so there are many other cancers that share the gene. Intimately related to breast cancer is what we call melanoma, which is skin cancer, very common in Caucasian patients, but ovarian cancer. So if you have a mother, you yourself have been affected, or a sister, so there's a lot of ovarian cancer. Breast cancer can be high on the cards as well. Incidentally, the breast cancer 1 and 2 gene are related to colon, pancreatic and prostate cancers, and you'll notice that a lot of them share hormonal preponderance, what we discussed earlier. So genetics is
just to put viewers into perspective about how the genes work. So you obviously inherit one gene from your mum and one gene from your dad. So if you've got a susceptibility gene, that means you've got an abnormal gene that you've inherited from either your mum or your dad. So even if there's a history of breast cancer in your aunts from your father's side, it may be concerning. But what happens is you inherit one of these genes, and the other gene will then undergo spontaneous mutation. It doesn't happen in everybody, which explains why not everybody who inherits the gene gets the cancer. But in all our bodies, as our cells turn over and multiply, some of them undergo spontaneous mutation. The genes get damaged with time as you age and so forth and so on. And if both genes are suddenly damaged just in the right area, these particular genes, they may make you very susceptible for cancer, because often what these genes will code for is either a growth factor, so they'll code for something which makes cells grow very quickly, or they will code for something which prevents cells from growing. So if you stop preventing cells from growing abnormally, the cells grow out of control. Or if you stimulate them to grow abnormally, they grow out of control. So in both ways, you end up with a lump of cells which are growing in an abnormal way, and that really is what cancer is. And that's why it's not just breast cancer. It's often many cancers which are linked to certain specific genes, and there are many different genetic susceptibility profiles which have been identified now, which put you at risk of certain types or multiple types of cancer. I mean, the big ones in cancer are the BRCA genes.
They call them BRCA1 and 2 genes. There's so many more genes that have been researched. Remember that these genes have classically been investigated in the Ashkenazi Jewish and Afrikaner population. Inshallah, they're doing more research now on our local African population.
Nadia, I'm going to interrupt you. We have a caller, and let's see if we can help. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh.
How can we help you, sister?
You're speaking to Mumtaz. I just have a quick query.
Sure.
I have a cousin that discussed something with me a few weeks or months ago, and I just wanted to find out, how do I encourage her to seek help. She apparently has a lump in her breast and hasn't attended to it.
Okay.
She's around 36 years old.
Okay, Nadia.
All right, Mumtaz, Assalamu alaikum wa rahmatullahi wa barakatuh. Mumtaz, I would strongly advise you, as her confidant and somebody who loves and cares for her, to slowly encourage her and tell her to actually seek medical help. So she might have a loved, trusted doctor, a general practitioner or gynecologist that she feels she could confide in, that could be able to do a physical breast examination on her. If not, she should be sent through to a specialized breast center where she can undergo an ultrasound. She's, I understand, 35, 36 years old. Look, 8 out of 10 lumps are not cancerous, and there's the fear of the unknown, fear of being diagnosed with something that potentially could be a breast cancer. At her age, it easily could be a benign lump, but meaning a non-cancerous lump, but she should seek help, because should there be a chance that it's not, let rather a medical practitioner be able to do investigation, and that will entail painless ways of investigation. So she'll have a physical examination, she could be sent through for an ultrasound examination, and inshallah, eventually to a probable diagnosis. Why this is so important is because our women need to be empowered about our breasts. We're only aware of it when we're really feeling something abnormal like a lump, but self-examination should be happening, and the fear of a possible diagnosis shouldn't keep us back from trying to seek help and really come and solve the issue.
I mean, all the hullabaloo around breast cancer is because early diagnosis makes a substantial difference. So the smaller the lump is, or the earlier you pick it up, the easier the treatment is for the majority of people. So if you really pick up a small lump which has no evidence, which is cancerous, which turns out to be cancerous, which has not spread to the lymph nodes or has not spread beyond that breast, sometimes it can be treated with just removing the lump, or other times just removing the breast without radiation or chemotherapy. Sometimes it requires radiation or chemotherapy. So really the things which determine how cancer is treated in terms of the breast is how early it's picked up, whether it's limited in location to the breast or whether it's spread out, and also what the receptor profile and so forth is, and what it looks like under the microscope. So those are the issues, and you can see that if the earlier you pick something up, the easier it is to treat usually. Yes,
she shouldn't procrastinate. Early detection is very important, like Shoayb said, and it easily could be a cyst, it easily could be a fibrous lump, it easily could be a lymph node, but it needs examination by a medical practitioner and eventually a radiologist who will do an ultrasound or a mammogram on her to actually have a definitive diagnosis eventually, inshallah.
I mean, it's difficult to say this, but one of the most tragic things really about breast cancer is that it often does affect women in the prime of their lives, with very young children, with growing families, families that are just sort of maturing at around the age that your friend is. I'm not saying that she has breast cancer, but at that age it really hits home the hardest. Often if somebody is 75, 80 years old and they get breast cancer, it doesn't have as much an impact in terms of psychologically on the family and so forth. But at that age, it usually has a huge impact on the family and the well-being of the family. And so often, people are much more fearful to even approach that topic. But it's important to pick it up early. Jazakallah so much for your call, sister.
Okay. Jazakallah so much. Assalamu alaikum.
I think we have another call. Okay, so I think we have another call online, but we'll get to that call in a second. I mean, I think it's important what Sister Mumtaz was saying, that there's lots of young people who are in that middle age sort of period between 35, 45, 50, who really think, I'm just too young to have cancer. I'm just too young. It can't be. And as you said, the majority of them won't be cancer, but if it is, the impact is just so much greater in that age. We have another call, Nadia. We'll get to that. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam.
How can we help you, sister?
I was just wondering because my mom and I both were diagnosed with cancer, and my cousin as well, within the same year.
What's your name, sister?
My name is Amina.
Okay, all right.
And I mean, what are the chances of, you know, within a few months of being diagnosed with two different kinds of cancer? And I'm in my 20s and my mom is in her 50s.
Yeah,
so,
that does sound, I mean, I must say, it does sound very worrying, Nadia.
Yes. Look,
yeah.
Amina, Assalamu alaikum wa rahmatullahi wa barakatuh. Amina, you know, there could be a genetic factor here. Depends what type of cancers you're diagnosed with, but there could also be environmental factors that could be contributing. Remember, familial risk is one thing, but environmental factors can cause genetic mutation and consequently be carcinogenic to induce a cancer. Here, with 3 different people in the same family, I would first and foremost think about inherited risk. And it depends what type of cancers.
It is concerning though that they were asynchronous. That means it's all at the same time.
That's my most worrying factor.
Because if your mom had it, obviously she was much older than you when she had, and she hasn't had a cancer before.
No.
I mean, there's a couple of things environmentally which have been linked to breast cancer. One of them is BPA. I don't know if you want to speak about that, Nadia. It's a product in plastic milk bottles and other bottles which was thought to be causing a release of estrogen in the body, especially when those bottles were heated.
Yes, and now they're making BPA-free bottles, you know, widely because they've been found to be carcinogenic. There are many carcinogens. There's hypotheses that, you know, there are products, whether it's chemicals in our food or hormones in our food, because now we're commonly, you know, consuming.
Sure, and cows are given estrogen at the moment to help them to produce more dairy.
More dairy, the chickens, so that they are more productive. There's also, they're mentioning parabens or methyl parabens or propyl methyl parabens in our makeup and in, you know, some of the aerosols. There's insecticides and pesticides on our food that we're commonly consuming. There's a lot that seems to be carcinogenic.
Sister, I think, you know, your case is actually reasonably unique. We don't often see that where 3 individuals are diagnosed within close time period, you know, from the same household, and it is strongly suggestive.
And, I mean, we went for genetic counselling, and one of the, you know, problems that we came about was that most of the research in South Africa is based on, you know, African population.
Yes.
And my mom and my parents, my grandparents, where the cancer is coming from, is from an Indian background.
Sure. So you're absolutely right. The genetic profiles differ in different populations, and as more and more research comes out, we may have more information. But it's worrying to me that it's all at the same time. Are you being treated by an oncologist?
Yeah, I am.
I think I would recommend that you speak to your oncologist. Are you all being treated by the same oncologist?
No, but they do. They know about our case, so that they're quite aware that we've recommended for genetic counselling and everything. That's how I know that, you know, the research is mostly on the African or the Jewish population, but not on the Indian background. So I mean.
But I think you probably need actually almost a forensic audit of what's happening in your household to see if you may be at particular risk because of some environmental factor which you may be all being exposed to. The other worrying
factor is also completely off case, but my brother has also been getting, we went to the dermatologist and they said that he's got urticaria.
Urticaria, It may be that you're being exposed to some type of toxic element within your household or within your environment. Maybe something that you're eating, one of the containers you're eating from, maybe you're sitting under some type of cell phone mast or something. Not that there's strong evidence to show that it's linked, but I think it's actually worth your while if there's 3 individuals in your family who've been diagnosed at a close period to actually report this to the health authorities, and they should investigate. And I think your oncologist can probably coordinate that, and I think it's actually their responsibility to do so.
All right. Thank you very much.
I would suggest that, because if you don't do it, and it is something environmental, it may lead to further cancers in other members of the family as well. And there have been other cases in the past which have been described of synchronous cancers occurring within a community or a small family unit linked to environmental toxins.
Okay.
Okay.
Incident. Assalamu alaikum. Shoayb, we're talking about these carcinogenics. In male breast cancer, they're finding men that are working on electrical lines and with petrochemicals.
Yes, so petrochemicals is a big one. Yes.
And then this inhalation, so lung cancer is very, susceptible, but breast...
petrochemicals have been linked to a number of cancers, including pancreatic cancer, breast cancer, lung cancer. So they may, and lymphoma. So there may be, other environmental toxins which may be linked to different types of cancer. And it's important. It's important for the family to investigate that. I mean, I think that's really an unusual situation. Usually, in a genetic, we do find that in future generations, it tends to be happening a bit earlier. The cancer. So if your mum had it maybe in her 40s, the next generation may have it in their 30s. As you say, and it's because of some of the changes in our lifestyle with more estrogen-containing pills and so forth and so on.
Shoayb, it's actually scary. I got to a point, after seeing so many young women in my practice, that you actually sit and reflect and think to yourself, let me practice that if I get diagnosed with breast cancer, what the response should be. Yes, I will commit to treatment. Yes, doctor, do whatever you have to do. Yes, I'm going to be a survivor. That's how serious it has been. There's an alarming increase in the incidence of young women affected by breast cancer. A lot is unknown, and the challenge we're finding is pregnancy-related breast cancers. So pregnancy-related breast cancers are breast cancers found within that time period of pregnancy or the year after while they're breastfeeding. So I'm finding a lot of patients that are affected that way.
Well, I mean, I think that's some patients obviously are more aware of their breast during pregnancy and soon after, because obviously they have breast tenderness and so forth, which is brought on by pregnancy. And then obviously when they're breastfeeding, they may be palpating their breasts a bit more as they are suckling the child and so forth and so on. So I think that may be one of the reasons why they're picking it up. We're going to go to another ad break, and then we'll come back, inshallah, and we'll look forward to a further discussion on this topic.
At Trent Tap and Tile Ormonde, we offer you the best solutions to your specialized home improvement needs. Just off the M1 highway at the Xavier Street off-ramp. We're open 7 days a week for you. We stock a large variety of top international and local brands, such as Grower, Geberit, Saloni, Summerplace, Libra, Geo, to name but a few, the very best. From exclusive polished porcelain tiles to the latest in sanitary technology. For the very latest and best in exclusive bathroom design, flooring, sanitary ware and taps, visit our exclusive showroom at 262 Crownwood Road, Ormonde, Johannesburg. Trent Tap and Tile, your home, our passion.
Welcome to Dada's Motorland, South Africa's premier used exotic sports car dealership. We stock only the best from BMW, Mercedes-Benz, Porsche, Ferrari, Lamborghini, Aston Martin, Maserati, and much, much more. So if you have the need for speed, come into one of our branches and select the vehicle of your choice. With dedicated staff to ensure your satisfaction, there's no better place to get the wheels of your dreams. Dada's Motorland.
Jad Doors offers the finest in exclusive door design. From standard to custom-made designs, we give you wooden doors and windows, sliding doors, folding doors, frames for all your interior and exterior design plans. Come visit us at our showroom. We bring to you innovative products and designs to suit your requirements. We also provide the wholesale trade sector with high-quality, locally manufactured products. Jad Doors. Call us or visit our website today.
Life is full of many joyous moments, and we want to enjoy every one of them. But with time, our bodies just can't handle it because of painful joints. That's why you need OsteoEase Gold, a joint supplement that assists with better mobility, flexibility, and joint health. Live your dreams with OsteoEase Gold, the gold standard in joint care.
Your one-stop home improvement center. We carry the biggest range of boards. Proud stockists of PG Bison A-grade products, We manufacture Sino high-gloss acrylic boards. We carry the biggest range of PVC panels for ceilings. We cut, edge and drill boards. Contact us at boardcity@telcomsa.net or call us on 011 852 6453. Call us now. Global Flooring. We specialize in porcelain tiles, wall-to-wall carpet, laminated flooring, and moss carpet. Allow us to design, supply and fit your own personalized masjid carpets. Come to us for the lowest prices without compromising on quality. Visit us at number 10 Stella Avenue, Crown Mounds, Johannesburg. Contact us on 011 83 00 55203. Email global@mweb.co.za. Visit our website at globalflooring.co.za.
Assalamu alaikum wa rahmatullahi wa barakatuh and welcome back. We've been discussing breast cancer and some of the issues around it with Dr. Nadia Jajbhay. I'd just like to remind you of the phone number. It's 011 086 7700. 011 086 7700, and you can see the number there on your screen. Nadia, we had a caller earlier, and one of the things which people don't realize is by the time you find the lump, it's not early, it's often a way down along the line. I think you've got a slide which sort of demonstrates that. Maybe we can put up slide number 6 and we can have a look and see what we're talking about, Nadia.
Okay, Shoayb, if you look at this chart, it says the average size of a lump found by yearly mammography compared to the next mammogram, which is below that, and then the average size of lump found by accident on self-examination. Or you'll notice that lump found when you come for mammogram is quite much smaller, and that's what we call an early detection.
Especially if you've had mammograms before,
yes,
which you can compare to.
Exactly.
So if you can compare it and you saw there was nothing there before, and now 2 years later there's something different there, then you may pick up something much earlier.
Alhamdulillah, Shoayb, we're not only, once we found a lump, that means the tumor has already become so advanced that there's something to see. We're actually finding the precancerous type, what we call ductal carcinoma in situ, by microcalcifications. We're seeing early spiculate masses, which are these tiny little cancers. And
so as technology improves, you're going to pick up more and more.
Yes, and that is really life-changing. We have women who have survived their past breast cancer many years. I've got women who are 21-year survivors, women who've been diagnosed in the 90s, and breast cancer is now a thing of the past. So having seen that, I have, funnily enough, I have a lot of patients ask me, well, I can't believe you do this daily. I mean, it must be so depressing, and dealing with breast cancer and counseling and so forth. And I say to them, you know what, I wouldn't do something that I didn't believe in. If I didn't see women surviving breast cancer, or I thought there was no hope, I wouldn't be able to do that daily. And that makes me so passionate about actually trying to, if we can affect people in the community and inshallah save lives, I think that's the take-home message. It doesn't have to be a death sentence, and the key is really coming in early and going for regular examinations.
And then dealing with it, depending on what arises. And as you said, I mean, I think just to put it into perspective, if 100 women come in for screening, maybe you're going to find something in about less than 10 of them. Am I right, Nadia? Which would probably need to be further investigated.
Yes, but it's on the increase, Shoayb, alarmingly. Yes.
And then of those, the majority of them will still be not cancer.
Yes, so then how we quantify that is, 8 out of 10 lumps are not necessarily cancer. They could be fibrous lumps, cystic lumps, fat lumps, lymph glands, hormonal changes in the breast.
And the investigations are not necessarily a biopsy. You could do an ultrasound. You could do
follow-up ultrasound. So classically, you'll have a young woman in her 20s coming through. She palpates a lump or feels a lump. It's painless, and it might be growing. We have a look, and the imaging or the ultrasound, and physically it's moving around like a breast mouse, we call it. and on ultrasound, very well defined, and we can do serial ultrasounds as long as it's not deforming the breast, it's not very painful, and it's not growing. We generally advise. Yes, they could live for the rest of their life with the lump if it's not causing any distress.
Yeah.
We are in a day and age of being very fearful. I would say, what do we do with this increase? This program is not to put the fear in you and everybody's just running out for mammograms. It's actually to educate you and realize that breast health is a priority. Breast cancer does exist. I liken it to the situation we have in South Africa. We know that crime is rife, right? And we could all just sit at home, lock ourselves in and say, well, you know, I could be a possible victim of crime. I look at it this way. If we can prevent by lifestyle changes and so forth, we do it. If we can do self-examination and have a better awareness of our self and our body, that's going to go far.
Sure.
And then we already realize that we need to be in the screening program. So as a young woman, yearly, I go for an ultrasound. If I'm under 35, I have a physical examination by a loved, trusted doctor, be it the GP, the gynae, or a radiologist who's going to do my ultrasound. When I reach 35, if I've got no significant risk, I go for my first mammogram, and then annually from 40, I'll be asked to come for screening, meaning I have no problem and there's a possibility of early detection. I made a conscious decision that if breast cancer is going to happen, it's going to happen. Mammography is not going to stop it, but I've got a chance to be found in the precancerous stage or stage 1 or stage 2. By the time I'm feeling something, it possibly could be a more advanced process. And, you know, this is the type of thinking. And, inshallah, our love-trusted doctors out there, our general practitioners, our gynaes, and everybody who's involved in a patient's health actually identifies women who possibly could be higher risk and send them for earlier screening.
Yeah, no, I think it's important that you engage with your primary caregiver. You know, that you discuss with them the possibility of whether you need to have a mammogram done, whether you need to do any other test, what your risk profile is. Not just about breast cancer, but about many other conditions. I mean, I think your primary practitioner has got a pivotal role. You shouldn't just be going in for colds and flus and then spending 5 or 10 minutes and leaving with a sick note and you know, some antibiotics or a shot. What you really should be seeing your primary practitioner as is somebody who's going to help you understand your body, who's going to lead you through the healthcare process in terms of maintaining your health, not just going when you're sick. So sometimes it's inconvenient to go when you're not sick. You know, to go and make an appointment to have a mammogram and so forth and so on, or to go and see your doctor just to have a blood pressure. But when you do go, even if you are ill, it should be an opportunity for you to engage with the doctor and say, look, has my blood pressure been okay? Is there need for me to do any other testing? I'm 43 years old now. Should I be looking for any other medical problems? My sugar, November is now diabetes month, so you may want to check your sugar just as a reminder. So those are the type of things you should be engaging with your general practitioner. And it's important, I think we've moved past the stage now, tragically, where people have a family doctor, you know, and I think it's important if as a family, if you can identify and as not just as a loved, trusted person, someone who understands your family history, understands your dynamic, you're comfortable with, you can see regularly, you know, many of the medical aids and medical funders have these managed care programs now where if you see a doctor in additional time, it's not going to cost you much more, especially if it's for screening, especially if it's for checking your blood pressure, your cholesterol, your sugar, and those type of things. So I think it's important that you identify for your family someone who's going to coordinate this type of care for you, and who you trust, and is going to be able to give you sound medical advice, you know, to take you through your life, inshallah.
Mm-hmm. Shoayb, if I have to say my goal with women really is as mothers and as women in the community, you know, when you're educating your daughter and she's developing breasts, or I mean, just general women's health, right? Sure. We tend to focus only on the gynecological aspect of things. We'll say, well, you know what, you're going to get a period, you must buy pads. If you have an abnormal discharge, or infections can happen, and then safe sexual practices, etc. This is all part of our now education at the moment. It's my hope that women then also mention, you know, lovey, you've got a breast, you must wear a well-fitting bra, not too tight, and she demonstrates to her daughter, this is self-examination. If you have any problem, my darling, please come through to me and I'll take you through to a female doctor. Alhamdulillah, we have women in the community now. Sure. With us as a specialized breast center, you know, there's more personal contact if you undergo through an examination, try and address a breast problem. And if you undergo a biopsy, we sit and we go through results with you. That education is going to go fine. Inshallah, we have women, inshallah, with time, a disease-free generation, or women surviving breast cancer, and inshallah, no breast cancer one day. But breast health is important. It's about, not everything is cancer. We mentioned a lump can be a fibrous lump or a cyst, and you know, these things need to be discussed, and it's my goal, inshallah, that women find this as an importance.
Sure.
Yes.
Yeah, and I mean, it's important as part of your global health to educate your kids, both your sons and your daughters, about how to look after themselves. I think it's important when you brought it up the last show that we had as well, Nadia, that part of your education of your kids is not just how to have good aqidah, good manners, how to respect the elders, how to use the education, how to you know, be financially secure. Part of the aqidah you want to teach your kids, and part of the lessons you want to teach your kids, is how to look after their body, which is an amanat from Allah subhanahu wa ta'ala after all. How to respect their body, how to, and I mean, many parents already do that. Make sure you brush your teeth. We do that in many, many ways, which we are obvious to us, you know, but some of them are not so obvious, especially as you mentioned in terms of sexual health, breast health, you know, making sure they don't, they stay physically active, they don't smoke, they keep their weights down, have good eating habits. So all those type of things, you know, we build in through the household, and that's really your first general practitioner, health practitioner. Your first, every practitioner is really your mother, you know, who's going to be educating you about all these aspects of your life, and often then your father will come in as well. I think fathers are a bit shy about discussing these things with their daughters, but I think if there is a mother available or a female relative who can do that, it's often much more comfortable and easier, but sometimes this falls to the father as well.
Alhamdulillah, Shoayb, I have husbands that bring in their wives and are very concerned and say, look, there's a woman that will be able to do your breast examination, and I'm concerned about you, come through and have an examination. So I think we're in a better time and age. Yes.
I hope there are some husbands out there watching the show who will also be assisting their wives and their daughters, as you mentioned. I mean, I think once more, Nadia, we're almost at the end of the show. I just wanted you to give us one or two more things, just to take home. So if you come in and you have a mammogram or screening examination and you've got a lump, or you've got a mass or there's something abnormal, what 2 messages or 3 messages would you give a woman with that type of problem? You know, how to take it forward, and maybe to make her more comfortable about taking it forward.
My best advice to the sisters are that breast cancer does exist. All breast lumps are not cancer, but if you're examining yourself, you're aware of your breast, you're acknowledging that it's important. If you feel something that you're not comfortable about, what does that mean? An unexplained pain, a difference in the texture of your breast before it becomes a lump, or grittiness, something that doesn't go away with the period. Changes to your skin, your nipple, a rash, a lump under your arm. Please, I beg you, do not sit and procrastinate, it might not be cancer. Rather go through to your love trusted doctor, let them send you for an ultrasound or a mammogram, and let us diagnose and treat that, perhaps an infection or inflammation. We are in a time and age, alhamdulillah, of better technology. There are female doctors available in specialized breast centers. You're able to get the care that you need. As a Muslim woman, I plead to you that Allah subhanahu wa ta'ala has given us healthy bodies, like Shoayb has mentioned, and it is an amana, it is our duty to, if we are diagnosed, now I'm going on to the next stage, if we are diagnosed with a dreaded disease like breast cancer, it does not necessarily have to mean a death sentence. We need to have that fight for survival. We need to be able to commit to treatment, and we need to put our faith in Allah subhanahu wa ta'ala, who has given us that, and ask for His healing and go through the means that He has prescribed to us. And just a reminder that even medical treatment, all the medical treatments that we are prescribing are not non-Islamic treatments. Everything is from Allah. And the complementary treatments, I would say, not alternative treatments, that we've been given through our prophetic traditions are of utmost importance, and we should use them in conjunction with the medical treatments, because all are from Allah.
Jazakallah khair, Nadia. Once more, I'd like to thank you for your information and wise words today. And we pray, inshallah, that Allah subhanahu wa ta'ala grant shifa and comfort and guidance to all those who are suffering from any afflictions, who have any difficulties, whether they be medical, whether they be spiritual, or of any nature. Jazakallah khair, and thank you for tuning in. Assalamu alaikum wa rahmatullahi wa barakatuh.